Avik is the co-chair of IIT Bay Area Leadership Conference 2017. He graduated from IIT Kharagpur in '98 and he has also been representing the IIT Kharagpur Alumni Association for about 4 years. He runs a company which has a data layer for the clinical trials, and they have been very successful with it. So let's learn a little more about him and his work with the IIT Bay Area Association as well as his data analytics company. Welcome to Sitare TV with me, Jasleen, and tell us how you got associated with the Bay Area Leadership Conference.
Thank you, Jasleen. So yeah, I've been around for quite some time. In 2003, when we first started the Pan IIT initiative, I was the youngest member of the core committee. So it's been a long journey since then, and never been able to get out of it. Along the way, I was the president of the IIT Kharagpur Alumni Association for about 4 years, and last 2 years since we started the Bay Area Leadership Conference, I've been co-chairing it. It's a fantastic team to work with, and it's a pleasure being part of the team. On your other note, we founded a company called CliniOps, and we provide a software that helps with the clinical trial data collection, data management, data analytics, data safety, security, and all that stuff. So basically the data layer for clinical trials and global health projects, been around for about 3 years now, currently supporting projects around 12 plus countries, 12, 15 countries across several countries in Africa, Asia, South America, and of course US. Help with tablet-based, completely mobile, completely offline, and a lot of built-in analytics into it, so that the data layer at the beginning is of much higher quality, and then you can do a lot of stuff on top of it. And there were many operational efficiencies that currently happens, which is basically shrunk just because we were able to collect the data at the source electronically. So that's basically what we do. And in a typical clinical trial, we'll probably have 50 countries, data collected from 50 countries because of the different kind of samples, what works for one country, one geography, one culture, diabetes, people in different places eat different kind of food habits, climatic conditions different. So it's a very diverse set of data that gets collected, and that's where we chip in, and that's what we do.
So you mentioned the PHI data in healthcare. We have the HIPAA compliance issues and stuff like that. So how do you do the data masking? Do you use the tools like TDM, test data management, or how do you basically protect that health information which should not be shared widely? Because when you fetch such kind of a data, it is very likely that it undergoes a risk of being shared in an unwanted way.
Yes. Fortunately for us, unlike the healthcare, so we are in the life sciences domain. So what EMR is for healthcare, you can say EDC or eSource, what we do is for life sciences. This is very unstructured. You can get healthcare data from various different sources. A doctor is sitting here, a hospital, different people with different requirements will come. Some with a problem in eye, some heart, some lungs, some all these kind of things. And you can collect data from Facebook, LinkedIn, Twitter, a bunch of different ways, right? Unstructured data and all. But in life sciences, it's very structured data. Because this is bringing a new drug to market, zero chances of error. I mean, you can't have an error because you're bringing an absolutely brand new drug to market, right? So the checks and balances are very, very rigid, right? So in that case, it's exactly, we know, there's a fixed protocol that has to be approved by IRB before it even starts, and you can give that first drug to human when it gets triggered, right? So all these things makes it very structured. So we know exactly what data are PHI and what data is clinical. So the clinical data goes back to the sponsor. Sponsor here is whoever is sponsoring the trial. For example, these Pfizer, Merck, Sanofi, Novartis. So pharmaceutical companies, biotech companies, and global health foundations. And what data needs to stay at the site. So there are 50 sites around the world. These sites will have access to just the PHI of just their site. This other site will have just the PHI of just their site. And on top of that, all the clinical data will go to the sponsor. So that's how it's structured. So we mask it very clearly as what goes where and how it's managed.
So only the relevant team gets the right data.
Yeah.
That's
so
beautiful.
Very strict user management built into the beginning. Who gets to see what, and who gets what access to what data.
Wonderful. Great access controls and great masking techniques that you're using. Thank you for sharing the insights. Have a good one.
Thank you very much. Hope you're all enjoying the conference. Thank you very much.